really don't want the public to know. And so that's the way they pulled me aside. They kind of shut my mouth. I didn't really totally shut my mouth. I still asked questions. I was superintendent for 5 years, so I was on that board for 5 years. And I made every point to make sure that when I retired in 2010, I made every point to make sure that the retirees knew about health insurance and about the things that the consortium were attempting to do or were doing, okay? In 2005, July 1st, I took over as superintendent in, excuse me, it was June 1st, 2005. I took over as superintendent July 1st, 2005. June 1st, the consortium privately, secretly met to add on a new health insurance benefit called Plan B. Plan B had much higher deductibles. It was definitely not the same. It was a cheaper plan for the districts, but it definitely was not comparable to Plan A, which I was on. My wife was on as well. And they snuck this in. And nobody knew about the meeting. It was held secretly. And they thought they got away with it. They put on they wanted to have this negotiated and in place throughout all 17 school districts by January 1st, 2006, okay? And that, of course, did not get accomplished. But from that point on, you could see the consortium was not working necessarily in the interest of the actives as well as the retirees. So that really got me inflamed to start working in health insurance, working towards health insurance, et cetera. And especially when I retired, it became very important. Today, I am on the consortium board has changed their ways, and this would be back in 2017. Would that be correct, Mr. Joyce? Okay, about 2017. They did two things. One is they got rid of Excellus, okay? They got Empire Blue Shield, which is kind of comparable. That's one thing they did. The second thing they did, which was most important, the person that was the advisor, the administration person, they got rid of that person. That person sat in that position from 1991 until 2017 without ever an RFP being done, okay? As it turned out, that person, and as well as Excellus, to the best of our knowledge, the rebates that come out with prescriptions, the school districts, the consortium, never got that money. That money went to Excellus, and the individual that worked with us for all those years, 91, probably got a piece of the pie as well, okay? Unfortunately, it doesn't look like any legal actions are being done on that, but that remains to be seen. If they're going to act, they need to act rather quickly because there's a 7-year date on that. There is now, in the restructuring of the consortium, there is now an advisory board. You still have the board of the consortium board, which makes up the 17 superintendents and the BOCES district superintendent, but they also have some voting members from NICET, from CSEA, that also sit on that board. So it's not just the superintendents and BOCES, it's expanded a bit. But the advisory board has a number of people on it. Representative of Rennie is on there, which was Bob Joyce, who's sitting in the crowd, and I took over for him this past year, so I'm on there. NICET has 1 or 2 people on the advisory board, and you have CSEA has 2 people on the advisory board, and there are some teacher representatives on both boards as well. So things have definitely improved as far as the communication and the transparency, I guess, would be the best term to use with the consortium. So that's where things are at this point. Taking a look at the agenda, okay? You see, and you have in your handouts, you have a terminology. What I found when I was president of NISRTA at the time, and then it became running, I conducted a survey throughout the state with all the zones, and I found that there was terminology issues. There were people that did not fully understand the terminology of health insurance. So for some of you that know health insurance in and out, I apologize that some of the terms are kind of simple. But some of the terms are a little more complex, and I'd like to take a look at some of those without a PowerPoint. By the way, Gayla didn't say why. I have done a PowerPoint in the past. I got rid of my laptop, and I got a Chromebook. And the Chromebook, as far as USB ports and stuff, it has hardly any. So hooking that system up to, I am technologically challenged, and this is the old-fashioned way that I know and love. The other thing is, I've done probably about maybe a dozen, not even a dozen, maybe 10 PowerPoint presentations in my career as a retiree as well as a superintendent. I did 4 as a superintendent, and 2 out of the 4, the system broke down, okay? So that kind of set me on the wrong term. So I'm using the old-fashioned way and the handouts, et cetera. On the terminology, I'm not going to bore you and go through all of them. It's there for your, in the handout. There are a few that I do want to kind of highlight. Medicare, we all know what that is. How many people in here are on Medicare, are Medicare eligible, as they call it? Okay. There's another avenue to get on Medicare, which is not the avenue that necessarily you want to take. I worked for 4 years for Social Security. I left teaching for 4 years and worked as a Social Security claims rep. This was in the early 1980s when Ronald Reagan became president. Remember what he did with the air traffic controllers? While he was not necessarily friendly to federal workers, I was there during the Reagan years, but part of the Reagan years. There's another way of getting on Medicare, and that's through disability. But you have to be disabled for at least 2 years, 2 years to life, and you have to pass the disability test that they run through. It's done through the state health organization, but it's a rather rigorous way to get on Social Security. The first time you file, about 10% get approved. The second is the reconsideration level, and that doubles. It's about 20%. The third is the hearing level, and that's about that brings it up to about 70 to 80% that get approved finally for disability. But if you're on disability for 2 years or more, you are then eligible for Medicare as well. So it's not just age 65. It can be obtained earlier. We all know the parts. Some of them are newer, A and B. A was the first one. B came on shortly thereafter. This is back in 1965 when Medicare was approved. A is the automatic one. That's your hospital insurance, inpatient hospital care. Notice I've highlighted inpatient. In order to be an inpatient, you have to be admitted to the hospital, and your length of stay in the hospital has to be at least 3 days, okay? If you're less than that, you're considered outpatient. and you may not be covered under Part A, okay? So you need to be wary of that. Not that anybody wants to say, oh, can I please be an inpatient? No. You got Part B, is what we all know and love, and also many of us pay for. How many in here have what's known as Medicare reimbursement? Actually, I don't. We have one, okay? The rest of you, this is a term that you're not familiar with. Medicare reimbursement is where your employer, school district, is paying for your Part B premium. It will pay the basic Part B premium, which now is $170.10, I believe, is what the amount is now. That's Medicare reimbursement. The rest of us have to pay for that Part B, and that's taken automatically out of your Social Security, so it's there, and it's gone up and up and up every year. That's Part B, and that's your doctor's office visits, your lab work, all that stuff. Your outpatient hospital care is under Part B as well. Part C is a new addition of sorts, and Part D is too. Part C is, and we'll talk more about it later, but that's Medicare Advantage plan. It's been there for a while, but Joe Namath has picked it up, and Jimmy, who's that other guy? Yes, you know, what was it? He was a kind of a comedian. Jimmy Walker. Is it Jimmy Walker does those Medicare commercials? Why are those so prevalent this time of year? September, October, it's enrollment time. Yeah, that's when you enroll into a Medicare Advantage plan. That's where you can automatically change your Medicare Advantage plan as you might have to another one, et cetera. So that's where you start seeing all these commercials. Thank God we have a federal election going on, because we're seeing less of those Medicare commercials than we have in the past. But now we're seeing all these political commercials instead. Part D is Medicare coverage of prescriptions. And C and D, oftentimes when you're on a Medicare Advantage plan, you will have to be on Part D of Medicare as well. So bear that in mind. I put in Medicaid because numerous times people say, I'm on Medicaid. And I'll say, you sure about that? Medicaid is for basically the people that are in need, okay? They do not have regular insurance. They could be in a situation, I'll use my mother as an example. My mother she was in assisted living. She had a very nice nest egg set aside in a 403B that she spent down in her assisted living facility. And the last 3 years of her life, she went to a nursing home. To do so, she had already spent down. She was down, at that time it was $13,000 is what you could have in assets. Assets being, you're allowed to have a house, you're allowed to have a car, but any other assets, stocks, savings accounts, other things that could be turned into money, you had to have below $13,000 at that time. I think the amount now is closer to $16,000 now. And that made her eligible, that plus the income that she was on, made her eligible to draw Medicaid. And that's what she was on. And because the cost in a nursing home where she was in Plattsburgh, New York, okay, it varies based on if you're down in New York City or Long Island, it's considerably more. But the cost in Plattsburgh, New York at that time was $12,000 a month for nursing home coverage. Okay, so Medicaid picked up most of that. She had to contribute her Social Security and her pension. She was a school secretary. She had a pretty good pension. That all got contributed, and then Medicaid picked up the rest. So that's how Medicaid works. most of you, if not all of you in here, are presently not on Medicaid. And hopefully you will not have to go into nursing homes, et cetera, and be put on Medicaid, because it's a troubling experience for certainly the individual if they know what they're doing. My mother had Alzheimer's, so she didn't know what was going on. But I was her caregiver, and it was a tough experience. The other term is supplemental insurance. How many of you in here have supplemental insurance from your school district? Okay. One, two.
You mean like
Okay.
Medicare?
Nope. You got Medicare as your primary. Your secondary, your supplemental, is what's provided that picks up what Medicare doesn't cover. That's your supplemental insurance. Okay. There's a distinction, and there will always be a distinction between Medicare Advantage plan and supplemental insurance. Supplemental is provided by your former employer, okay? Medicare Advantage is something you might get through AARP on your own or something like that, but however, that might be subject to change. I have down there primary insurance. For many of you, primary is Medicare, and the secondary insurance would be your supplemental insurance, okay? There are some people that have tri-insurance. They have 3 health insurances: Medicare, school district provided health insurance, and their spouse might have an insurance from their place of employment. Correction officers, for example, belong to night shift. Night shift becomes the 3rd provider of health insurance. So you have some people that's good. It pays for pretty much just about anything. However, sometimes the insurance companies don't talk to each other, and you have difficulties, especially between secondary and tertiary insurances communicating with each other. So that's something to be aware of. Yes?
What is like when we became 65 or 62, whatever it was?
65 for Medicare?
Medicare, well, we have Medicare, Excellus.
You didn't have Medicare Excellus. You had Excellus. That was your insurance provider between the time of you retired, let's say 55 to 65, okay? Somewhere in that period of time. I call it the shoulder years. You're not Medicare eligible. That was on the school district, and that was your primary insurance then. And when you turned 65 and became Medicare eligible, the school district took the back seat, okay? And that way, they did not have to pay everything, all 80% of the bills or whatever, okay? They also paid less of a premium for your insurance because they had become the secondary provider of insurance.
And that's when I stopped paying the school district, when I went on Medicare.
Right. It depends what your contract called for, okay? All right? So, yep. Medicare Advantage plans, I've kind of already explained that. One of the most popular is AARP, has some excellent Medicare Advantage plans. By the way, they'll say, call this number, just give us your zip code, and we'll tell you, how much it's going to cost for your Medicare Advantage plans. Joe Namath, okay? And all you have to do is call this number. Why are they asking for your number, your zip code? Because the premium on Medicare Advantage is based on the standard of living, I guess we'll call it, okay? The cost of living in your area. If you are in a dirt poor area, a holler in Kentucky, for example, your Medicare Advantage plan premium may be 0. But if you live in New York State, your Medicare Advantage plan premium is a minimum of it was $160 a month, minimum, okay? And it could be, that was last, well, actually, that's this year. 2022 is $160. 2023, it's gonna be more. So that's why they're asking for your zip code. You have HMO, PPO, very important terms. Does anybody have, obviously you got, I'm not gonna ask the question, does anybody know what a PPO is, a HMO? Are you familiar with those terms? Okay.
We have, through our district, we have the amount of preferred provider
Right.
organization. But a group plan, I remember when the agent spoke to us, that the only people on that are those of us who are on Medicare. The district changed it. If you're not eligible for that, then I think they're still on Blue Cross Blue Shield.
Yep.
But the agent told us when you're on this plan, if it could be any one of those Medicare advantages, if you can go to your doctors and so on, make sure you tell them that's a group plan, because the benefits are better when you're in a group plan than they are if you come in as an individual.
Yep. PPOs are the preferred plan to get,
Yeah, that's what we
okay? They're more expensive. Matter of fact, Rennie has two dental plans. One is an HMO, it's the old one. They're both offered by the same company. The HMO is a cheaper dental plan. The network for that dental plan is very, very limited, okay? The PPO that they just brought in about a year or two ago is a better plan, and it's got a bigger network of dentists, okay? But it also costs a bit more money for that plan. So that's there, and then you have network of coverage, which I just kind of touched upon. Extremely important term, especially when we talk about Medicare Advantage plans more. Network of coverage is extremely important, especially, how many of you go to Florida or south during the inclement months, okay? I'm gonna raise my hand high up too, okay? Florida, wherever you're going, most of you, the insurance you have, Medicare obviously is nationwide, but your insurance mostly are the Blues, okay? The Blues network covers pretty much the entire United States. You go out of country, however, different story. Out of country, Germany does not accept Medicare. Sorry, okay? But they don't. And they will not accept your Blues either. That has to be worked out. You're gonna probably have to cough up some money initially, and after a process, you'll get reimbursed most of it. Maybe not all of it though, okay? I've already touched upon Medicare reimbursement, but there's some important facts here, okay? It's a part of the school district contractually agreed promise and responsibility to provide 100% health care coverage. This was the philosophy, it was the practice of school districts providing health insurance back in the 1970s. 100% health care coverage. That's what they said that they would provide. So, lo and behold, Medicare is already in place, but when you retired, you weren't on Medicare. Medicare kicks on at age 65. You're entitled to 100% health care coverage. That's what the school district said. Well, guess what, school districts? You have to pay for my Part B Medicare. And many of them took on that responsibility. Today, they're trying to get out of that responsibility. And a show of hands, some of them have already succeeded in getting out of that responsibility, okay? But back in the 70s, when Medicare premiums, in 1970, the premium for Medicare Part B was $4 a month. Throw it into the cart. You know, we'll pick it up. That's, you know, it's going to be going up? Yeah, but geez, $4, what's it going to go up? 50 cents? You know, throw it into the cart. Well, when it started doubling, tripling, quadrupling, then they started saying, you don't want to pay for what's in the cart. and that came out in negotiations. Yes,
If you
Teresa.
accept a plan other than your, school district, do you have to drop the school district? You have Medicare,
Yep,
and you have the school district,
yep.
but you don't have C and D, you don't have the
You don't have
vision,
Medicare,
the
you don't,
vision, the
okay.
hearing, and
No,
whatever.
you don't have to drop the school. You can take on, because Medicare Advantage plans do offer things that school districts and Medicare will not provide. Dental coverage, vision coverage oftentimes, okay?
So there is a
You,
plan.
you can get a Medicare Advantage plan, but it's gonna be out of your pocket.
But I mean, if you get the Advantage plan or whatever,
Yeah,
and you get the vision, the, hearing and so forth.
Yep.
There's just no need to get out of the board's, the district.
You wanna stay in the district's plan, because the district's plan is paying, Medicare will pay 80% of your doctor's visit, for example. They pay 80% of your hospital stay, okay? The other 20% is put on the supplemental, which would be the school district's insurance, okay? There is no need to get a PPO in Medicare Advantage when you have school district provided health insurance and Medicare, okay? That's really, you're doubling, tripling, you're paying for something that you already pretty much have, okay? However, to supplement what the school district insurance doesn't cover and Medicare doesn't cover would be like eye care, vision, as well as dental, okay? They also, if you don't have Medicare reimbursement, Medicare Advantage will also pay for that Part B premium. That could be another part of the plan, okay? So you can craft that Medicare Advantage plan to what you don't have presently that you want to get, but it's going to come out of your pocket, okay?
So who was, so who knows about this? I mean, so that you compare and contrast, say, because my guess is most of us don't have the vision and the hearing and the
Right.
mental.
Very few do.
Let's, is there a group out there that is very good at that, so that we can get some,
My,
we can get some advice as far as what may
yeah,
be best?
my advice initially at this point is one of two things. Obviously, Rennie offers the benefits of vision and hearing, and also dental, okay, that's a possibility. You contact the Medicare AARP, there's a bunch of them, and see what they have to offer and how much it would cost for what you specifically need. But that would help. Again, the prices vary on what they offer, okay? So Medicare reimbursement, today the premium, as I said, is $170.10. We're gonna be talking a little more about that. Moratorium provision, we'll be talking a lot about this. This legislative understanding states that a state retired employee, public school employees included, are entitled to the same or better health benefits that they retired with. Same or better, not less than. Unless the active non-retired employees change, remove, diminish the same health benefits to themselves, okay? We're gonna be talking about two school districts. One is a plus and one is a minus. And we'll be talking about those very shortly. I've added on 3 other terms up here that when I did this, I forgot to include these. HSA, does anybody know what an HSA is? It's a health savings account, okay? Retirees, you are not entitled to health savings accounts. Active employees of school districts are entitled to health savings accounts. They help offset insurances. Health savings account could also provide dental and vision coverage that you might not otherwise have. HRA, that's an important term for retirees. Anybody know what HRA stands for? That's a health reimbursement account. As a retiree, you are entitled to receive from the school district a health reimbursement account. And that would help pay for totally or partly your premium and your supplemental health insurance, or your Medicare Advantage plan, okay? So an HRA is extremely important for retirees. Actives are eligible for both of these, but retirees are only capable of an HRA. CBA, some of you look like you're old negotiators. What's a CBA? No? Glad I put it up there. Collective bargaining agreement. That's your contract. And that's extremely important. We'll talk more about that shortly. Okay, we're going to move on to another page, and that page is going to be handed out by my assistants. This would be the first one, and this would be the last one. Thank you very much, gentlemen. Any other questions on terminology as we transition to the, yes?
We have, our school district said, once you turn 65, you had to go on the Medicare Advantage plan. And how much you pay for your premium depends upon what contract you hired under.
Exactly.
You know, you were hired, actually, so, like, they pay part of mine, and I pay part of it, but it covers dental, it covers, up to $300 for dental,
Yep.
vision, and hearing.
Is that the Medicare Advantage plan?
Yes, it is.
Okay.
Full-time mark.
Okay. Yeah, the contract that you retired with is literally next to your birth certificate. It is probably the most important document or certificate that you own. Yep, yep. Yes, never get rid of the contract that you retired with. Because if you run into problems and you expect the school district to have it in their archives, good luck. Okay? They may have it, but they're not going to find it, and they're certainly not going to just be, oh, let me spend the next 4 hours looking for it for you. No, that's not going to happen. You have to come up with it. All right? Otherwise, you are, and I'm not throwing them under the table, but you're dependent upon somebody else to find it for you. And that might, you might be a member of NYSED as a retiree, but do you pay any dues to NYSED as a retiree? No. Okay? And they like what you did when you paid dues, but when you don't pay dues anymore, you're kind of taking a back seat, okay? So that collective bargaining agreement that you retired with, hang on to, okay? And put it in a place that you know where it will be, with your will, with your birth certificate, important documents. Okay, the history of health insurance for retirees, okay? Well, Robert DeCormier, president of NISRTA, 1956, he crafted the first group health insurance plan for retirees in the entire, retired educators in the entire United States, okay? And this obviously helped with something that we are sorely lacking today. It helped with what? Membership. The membership of NISRTA back then was doubling almost on a yearly basis, okay? 1966, DeCormier stepped down after 15 years as president. He did start a retired home in Utica that got started in 64, 65, I think is when it opened up. And it stayed open for quite a while, long after he had passed, as well as long after he had served as president. But what you had come into play in 1967, you had what's known as the Taylor Law. otherwise known as the Public Employees Fair Labor Employment Act. That was put into effect. Prior to that, you had a guy by the name of Al Shanker in 1965 that formed the first teachers union. He was from New York City, so it was in New York City, but it became a national teachers union. Anybody know what the name of that union is still going on to this day? National. What? Not U. A, close. AFT, American Federation of Teachers. Oh, yeah? Yeah. Yeah, he was quite a character. This allowed New York State public employees to collectively bargain, come up with CBAs. Up to that point in time, there was no collective bargaining. You got what the board, the superintendent gave you, okay? There was no, you could maybe talk with the superintendent and say, well, I could use this or I could use that. I'll see what the board has to say, but you had just separate agreements. There was no collective bargaining agreements. This allowed New York State public employees to collectively bargain, as I said. You had school district allowed salaries, health insurance, and other fringe benefits to be part of the newly formed contracts for school employees and retirees. Retirees got folded in as part of it. However, were retirees allowed to be involved in the collective bargaining? Nope. There are a few associations in New York State, I don't think anywhere else, but in New York State, that do allow retirees to be part of the discussion, but not the negotiation. You're a non-voting member of the negotiation team. There are some that do allow that, but by and large, no. Retirees are excluded from that. So you are at the mercy of who? The actives, okay? You have to kiss their shoes, their feet, and yes, okay. Yeah. You have March 30th, 1972, Lewiston, New York. Teacher Tom Hobart. Anybody know the name of the high school that he taught at? It was Proctor High School in Lewiston, New York, which is near Niagara Falls. How many here are from Western New York? Lewiston, Central Western, or are you Western, John? Central Western. Okay. Hobart, he's a Western New York guy, and he became the first president for NYSUD when they formed. They were affiliated with AFT, and he formed that in 1972. And he served as president until 2005. So he got to see a whole lot of stuff happening with health insurance, a whole lot. What I want to point out to you is the power of NYSUD. 1965 to the early 1980s, teachers' unions ruled with CBAs. They knew their stuff, okay? School boards, school districts, superintendents were left floundering. They lacked organization. They really didn't know too much about collective bargaining. They were the good old boy syndrome, so to speak. And you have NYSUD comes in, and they get some very aggressive negotiators back in the early 70s. They were usually negotiators that had something that happened negatively to them. They got fired, for example, for really no reason. And they wanted to get their vengeance, and they did. They did it at the bargaining table. In the 1970s, teachers' unions, until the very early 1980s, teachers' unions ruled the CBAs. Contracts included very healthy health insurance packages, okay? Now, you take that, you'll see 1970, the average salary for teachers was $8,500. 1980, it had jumped up to $19,000. Now, we're talking about throughout the state of New York. So you got some places that were less than others. I'll use myself as an example. Remember I said I left teaching? Okay? I had taught for 9 years, 5 in a private school, 4 down on Long Island. I came back to teaching after being a Social Security claims rep because I hated working at a desk, okay? And I got a job at a place called Northern Adirondack. I was a social studies teacher. They were a dime a dozen. And I accepted a job in 1985, September 1st, 1985, I started at $18,400 was my starting salary in 1985, okay? So the average 1900, you got Long Island, they pay pretty good bucks. Dutchess County, that part of Rockland County, good bucks. Then you start getting into the other parts of upstate New York, and you see the salaries kind of wavering downhill a bit. 1990, look what happened to salaries, average salaries. They doubled to $38,000. In 2000, not quite a double, but considerable increase, $51,000. Then we start seeing 2010, $20,000 increase to $71,000. This is not just starting, this is average teacher salaries. 2020 is $79,000, is the average teacher salary. Now, let's take a look, 1980, 1990. What took a hit during those years? Health insurance. Remember all those giveaways that districts were doing when they didn't know the first thing about collective bargaining? Well, they came back and teachers wanted more salaries, and they were willing to give in on the health insurance, okay? And I don't mean to put Teresa, who's from Western New York besides Teresa? I know, I've known Teresa for a long time. She is the Pope, okay? Yeah, I will say that. I'll never forget 2011 convention. we're in the showroom, and this little lady stands up and says, "I am the Pope, and the Pope has spoken." And that was, remember that? Yes? Yeah, you do. Well, I remember it too. Anybody else from Western New York? Central Western New York? John? Okay. Anybody else? Okay. Those two areas, for one reason or the other, sacrificed in the early 80s, maybe the late 70s, but early 80s definitely, they sacrificed health insurance. At whose expense? Retirees. Okay? When I did my health insurance survey, a very important lesson I learned, there is probably about 20%, and this is a general statement, about 20% of the school districts in central Western New York and Western New York have health insurance offered to retirees, okay, by the school district. And I'm not talking about health insurance based on sick leave that you accrued, time off, leave, that type of thing. I'm talking about providing you an extra benefit of health insurance. There's only about 20% of the school districts in those large areas of the state that have health insurance for retirees, okay? Elsewhere in the state, they still provide something towards retirees. It may not be exactly what they had when they first got it, but it still provides some health insurance, okay? There are very, very less than 20% that provide health insurance to Medicare eligible retirees in Western New York, okay? And I mentioned Hobart. Hobart came from Western New York. They gave up health insurance primarily for retirees to increase their salaries, okay? And it happened, it was a gradual attrition that took place, and to this day, they don't have it. And a lot of them want it back, but they don't have it, and they won't get it back at this point in time. So that's basically why I brought up about Hobart. 1970, Part B premium was, as I said, $4 a month. And school districts were giving away health insurance because it really didn't cost them anything. They were giving away benefits. You could have sick leave, sizable number of days of sick leave, things, personal days, convert personal days to unused personal days to sick days. All those giveaways cost the school districts relatively little. And they made sure that they didn't have to pay the salaries, because salaries cost the districts quite a bit. 1983, a very important decision was made called the Yardman Inference. Has anybody ever heard that? This was done, it was a federal provision that was done in the Sixth Circuit Court of the judicial system of the federal government. The Sixth Circuit is located primarily in what state in the United States? We all know where the 11th Circuit is. That's down in Florida, Georgia. That's 11th Circuit. And we are the 3rd Circuit, I think second or third, is New York State, okay? The 6th Circuit is Kentucky, okay? And in that circuit, they came up, the federal court considered retiree health insurance in the context of ongoing collective bargaining and would infer that the parties intended to vest retiree health insurance benefits on retirees for life. What this meant, putting it into common words, is you did not have to negotiate. If you had a 3-year contract, you didn't have to negotiate at the end of the 3-year contract those retiree health benefits again. They were inferred to continue for the life of that individual, okay? That's the Yardman Inference. Extremely important inference for retirees. It is now under attack today. In the New York State Court of Appeals, 12/12/2013, in a court case called Colby versus Tibbetts, the decision involving retired employees in a school district called Newfane. Does anybody know where Newfane is? Newfane's in the Buffalo area, okay? It's actually between Buffalo and Rochester, that area. And it involved CSEA employees, 4 of them in particular. Civil service employees, might have been custodians, bus drivers, cafeteria workers, some secretaries, aides. They fell under the CSEA. The moratorium law was affirmed to state that retirees were entitled to the same or improved health benefits as part of the CBA they retired under. Should the act as negotiated diminution, it's a word, but I can't pronounce it correctly, of those health benefits to themselves and retirees, then the moratorium law does not apply, okay? And I said I'd mention 2 school districts, a plus and a minus. We'll do the plus first. Vince Smith is here. He was actually the person that first informed me about this when I was president of Rennie. Binghamton City School District. How the retirees found out about it was by happenstance. It was not a planned occasion. What's the name of the woman that down there that's? Lynn Hunkovic. She had a child, a son or daughter, that informed her about the negotiations that the active teachers were doing in the city of Binghamton. And they were discussing, okay, we're talking about 2018, 2019? This is 2019 it was. They were willing to give up Excelis Blue Cross Blue Shield insurance for United Healthcare, okay? And they did. There was a transition period going from one to the other, and it was kind of rockety at times. It has worked out to be better, but United Healthcare, of course, offers what for retirees? Medicare Advantage plans, okay? So they offered for the actives a PPO, United Healthcare, okay, insurance. They got rid of Excellus, which was an expensive health insurance. UHC was a bit less, so that was a bit of savings to the district. They had the retirees, Medicare eligible retirees, go on UHC Medicare Advantage. But it was a PPO Medicare Advantage plan that they had for the retirees, the Medicare eligible retirees. And as time unfolded, it became a comparable. At first, there were some issues with chiropractic care, and there's some questions about prescription coverage and stuff like that. But those got eventually worked out, and it turned out to be okay. Not great, certainly wasn't, it was close to being as good as what they had. Was it a violation of the moratorium provision? No. At first, we thought it might be, but as the district came up with it, no. The other one occurred in 2018, and that was Bayshore, Long Island. Anybody from Long Island here? Okay, Bayshore, Long Island is in Suffolk County. The great speaker we had last night talked about Suffolk County, the population and stuff like that. Bayshore, Long Island is on the south shore of Long Island. And it's about in the middle of, on the way to Montauk Point in Suffolk County. They had their teachers, the retired teachers that were Medicare eligible only, got put on a Medicare Advantage plan by the school district without any negotiations taking place. That Medicare Advantage plan was with a company called Aetna. All the insurance companies, for the most part, have Medicare Advantage plans. Aetna is not a good one to get, okay? Anybody here work for Aetna? Okay, good. I don't want to throw them under the bus too much, but I will, okay. What do we got? Yep. Anyways, Aetna, they didn't have coverage network with Stony Brook Hospital. That's where people went for cancer treatment down in Long Island, Bayshore, Long Island. They were not part of the network. Their network was terrible. Was it a violation of the moratorium? Yes, it was. Was anything done about it? No. The NYSET region in Patchogue, Long Island, decided not to take the case. I tried to intercede, bringing one of our members, who is a big wig in NYSET as a retiree, to intercede and try to get legal from NYSET to get involved in it, and they would not take the case. So the unfortunate people of Bayshore lost. They were on NYSHIP, New York State Health Insurance Plan. Okay, we have 1990s. I've been told I got limited amount of time. I'll just go over just a few things. New York State Court of Appeals affirms the provisions of the moratorium in 2013. That was in the Newfane case. 2015, the Yardman provision comes under attack. The U.S. Supreme Court case of Tackett versus U.S. Supreme Court did not uphold the provisions of the 1983 Yardman inference. They remanded such cases back to the discretion of the states, okay? You have two court cases that occurred, 2020, 2022, Donahue versus Andrew Cuomo and Donahue versus Hochul, that occurred, that involved this remanding, sending the situation back to the states to figure out. You now have before the state legislature, are they back in session again, or are they still on summer vacation? Or are they campaigning or something? They're gonna be coming back shortly after election day, but for a short period of time, then they'll take Christmas vacation. They're good at vacations.
Oh, yeah.
There's two bills, these are very, very important, that what ended up happening, they got approved, one got approved in the Assembly, one got approved in the Senate. But one of the bodies, one of the houses, made a few changes, a little verbiage change, nothing drastic. And what they then have to do is a conciliatory vote on one provision, one bill, and then it gets sent to the governor for approval. Kathy Hochul said that she would support what's put on her desk on this matter. But there are two bills that presently still have not been passed that we got to make sure the legislature gets to first and foremost when they come back. And you got the numbers there. These would assure retiree rights to the health insurance benefits they retired with. This would uphold the Yardman inference for the state of New York. May not be in the state of Pennsylvania, may not be in the state of Florida, but the state of New York would uphold the inference. So it's critical. And I want to give a plus for NYSED. NYSED picked up on this, and they ran with it. They lobbied for it, and all it needs to do is they need to have a conciliatory vote, and hopefully it'll pass. So your assignment is to contact the U.S. representative to assure that they approve these respective bills. January 2022, Medicare Part B, Medicare premium is $170.10, as I said. The good news, January 2023, Medicare Part B premium will be $164.90. It's gone down, and it has, I don't recall that ever happening. So, thank you, Brandon. We all know who Brandon is. That's his other name. The last item that I'll just put out to you, I was going to have some discussion, but we don't have a whole lot of time, but you got some discussion questions. As a retired educator or school district employee, are you entitled to school district provided health insurance? Do you have a right to health insurance? And if anybody in this room answers no, okay, then you should have found a different profession. You gave up salaries. You gave up a lot of benefits to have good health insurance. Yes, you are entitled to it. And if anybody questions you on that, you make sure you tell them what you sacrificed and what your predecessors sacrificed to get that, okay? Yes, it is an entitlement. You don't want to go around bragging about it because your taxpayers in the community don't really care that you have entitlement to health insurance because they don't have entitlement to health insurance. How many present have some form of, we've already kind of covered that. How many present have some form of school district provided supplemental? Very few of you do. After Medicare eligibility. Well, actually you do have supplemental insurance. There's only a few that might not have that. How many present have school district provided Medicare reimbursement? Very few in the room responded to that. Should local taxpayers be held responsible for paying your Medicare Part B premium? That's a good question, okay? It's something that is negotiable, and some people, say that that's one of the things that can go to keep our health insurance. Okay, we'll pick up the Part B, or we'll pick up a fraction of a percentage of the Part B. But, and then the philosophical question, in troubling economic times, what is the primary responsibility of the school district? Educate students, or, it's not and or provide health insurance to retirees. In 2021-22 school year, municipalities, towns, cities, villages, school districts, before the stimulus money came out, they were in very serious trouble. Because when the pandemic hit in 2020, 2021 school year, all those expenses for computers, masks, all the stuff that had to come up with the pandemic, okay? Those had to be incurred. There was no giveaways from the federal government or the state for that matter. That came out of the school district's accounts. And they were hurting. Their fund balances, which they were sitting on some pretty good fund balances, those got depreciated a lot. If the stimulus package had not come out, as it did, the school districts, many of them, would have bellied up. There were 2 school districts in our BOCES, Northern Adirondack, where I taught for 11 years, and Ticonderoga would have been 2 that would have bellied up. They were in serious economic trouble. Stimulus money came out, and it was literally a godsend, okay? But if that had happened, now they're now talking about recession and all sorts of stuff. Right now, school districts are doing pretty well. They've recovered a lot. But at any time, it could happen. Who's their responsibility to? Teaching students or paying for retiree health insurance? That is what we are facing in the future, okay? Thank you very much. There's some other things there, but you can take a look at them.
Thank you, Kevin. He's,
Okay.
I told you he knew all this stuff. He sure does. He probably could have gone on longer, and I wish we had time for a discussion. But thank you very much, Kevin, and I left for a little bit, but he did okay with the old-fashioned way.
Thank you very much. Thank you.
Okay, good job.
Thanks, Kayla.
Yeah, I took all that.
We call it the chalk and talk, guys.